Come in.
Hello, my name is Raymond, and I'm a student nurse at TW. Would you mind if I did a assessment on you?
Yeah, go ahead.
Okay. And what is your name?
Caitlin.
Okay. It's good to meet you.
Nice to meet you too.
And what is your last name?
Pilaris?
Okay. All right. And what day is this?
September 12th?
Okay. Do you know what year it is?
2018.
Okay. And when were you admitted?
Today.
Okay. So what unit did you get admitted to?
Psychiatric.
Okay. Okay. What is your age?
I am 22.
And what is your sex?
I am female.
All right. It's 2018. You know. We have to ask everybody. All right. So, and what was your admitting diagnosis?
Anxiety disorder.
Anything else?
No, that's it.
All right. And what is your chief complaint? The main reason for your being here?
I've been having a few panic attacks, anxiety attacks,
Okay.
a little more than usual.
And you mentioned usual. How much would that be?
Would be maybe once every few months, but now it's twice a month.
And your last one?
Was 2-3 days ago.
Okay, but you got admitted to that.
Mm-hmm.
And just to be sure, you said the last one was 2 days ago?
Yes.
Okay. And what were these panic attacks like?
It just feels like I can't breathe. And like it feels like if I'm like in a room, like the walls are like just closing in, and like I just like find out like no air in the room.
Okay. And could you tell me about your medical history?
Well, I'm supposed to be taking the medication.
And what might that medication be?
It's bad that I can't pronounce it.
That's no shame. But could you at least give me like an idea of what kind of medication it is?
It's just an anti-anxiety.
Okay. That's okay, you
I
know.
think it's like clonazepam, something like that.
It's alright, we can look it up later. But you know, after everything you've been through, it's understandable that you're, you know, having a tough time with some of this. Okay, and have you ever been treated for anything different from the medication? Have you ever had past surgeries, hospitalizations, head injuries?
No.
Any complications during your birthing process?
No.
Okay. So, when did this all first start?
Started maybe when I was 20.
Okay. Okay, and have you ever had any outpatient therapy done? Have you seen a counselor, therapist?
No.
Okay, and have you ever had any suicide attempts?
No. I guess I would say I think about it, but I'm not gonna do that.
Okay, so it's a suicidal ideation. And have you ever tried to self-mutilate yourself or cut yourself? Okay. And have you ever done anything to other people? Have you ever been violent towards anyone?
Sometimes during my panic attacks, someone has to touch me. I sometimes may lash out, but I never seriously hurt anybody.
I see. Okay. Do you mind if we get into your substance history? Okay. Do you drink alcohol?
Yes.
How much?
I would say I have maybe 3-4 drinks a week.
What kind of drinks?
Usually mixed drinks or cocktails when I go out with no friends.
Okay. And who makes these drinks?
We would go to bars, so I guess whoever's working that night.
Okay, so the bartender. All right. And when did you first start drinking?
I started drinking when I was 18.
Okay. Was that in the U.S.?
Yes.
Okay. And have you been pretty consistent with it?
I didn't drink as much as I did before, and I kind of just started drinking a little more with, just with friends. I don't really drink by myself or anything like that.
Okay. All right. Have you ever done any street drugs?
Street drugs.
Like, a couple examples of this would be cocaine, crack, methamphetamine, marijuana.
No, nothing like that, no.
And we brought this up a little bit earlier, but prescription medications.
Mm-hmm.
But you don't remember the name of it?
Not off the top of my head.
Okay.
I do know I'm supposed to take it every day. I think it's 2 milligrams.
Okay. All right. So, how much does your alcohol use affect your financial life, your social life, your, anything going on? How much does it affect it?
It doesn't really affect my social life.
Okay.
I try to drink too much.
Okay. Have you ever gotten into legal issues regarding alcohol?
No. If I drink, I don't ever drive home or just like walk the streets or anything like that.
All right, and do you have any motivation to go ahead and stop using substances?
I think I could cut down on my drinking. I don't really see a reason why it doesn't really affect anything.
Okay. Have you ever had any previous treatment for alcohol or drugs?
No, I have not.
Okay. Tell me about your family medical history.
Well, my family, usually like a lot of people in my family have like a heart disease or diabetes and dementia.
So heart disease, diabetes, and dementia.
Yes, and my grandmother was just diagnosed with liver cancer.
Okay, and you mentioned the dementia. Is there any other psychiatric history regarding your family?
Oh, no, my mom, she also has anxiety disorder.
Okay. And who was it that had the dementia?
My grandmother on my mom's side.
Do you have any allergies?
Just seasonal.
Okay. And you said you don't remember what the medication was called?
For
Your anxiety, and you were getting it before your admission?
yes.
All right. All right. And have you been pretty compliant with your medication?
No, sometimes I forget to take it.
And what is keeping you from doing so?
I just get really busy in the morning, and sometimes I just walk out of the house without taking it.
All right. And is that the only reason?
And it also tends to make me very drowsy and nauseous. So when I do take it, I don't really like it.
Okay. And tell me about your educational history. Do you go to college?
Yes, I'm in university right now.
Okay. Do you have a degree?
No, I'm just in the process of getting my degree.
Okay. And could you tell me about your work history?
I'm actually just a full-time student. I guess I work part-time as a personal trainer, but that's once or twice a month type of thing.
Okay. Could you describe your home?
Well, I live with my parents still because I'm still in university and I can't afford an apartment. But I get along with my family very well.
Okay. Do you have any siblings?
Yeah, I'm an only child.
Okay.
Which is kind of good because I get whatever I want.
It's the perks of being the only one. Okay. And do you have any problems with access to food or clothing or shelter?
No, we do pretty well financially.
Okay. Have you had any recent changes in your appetite or your weight?
No, I eat the same pretty regularly.
Okay. How's your sleeping going?
I guess it's subpar. I don't sleep really well. It takes a long time for me to get to sleep, but then I wake up the middle of the night, so I maybe sleep 6 hours. It's like on a good night.
And do you normally have more good nights than bad nights?
Yeah.
So you have more bad. Tell me about the bad nights.
I maybe sleep 5 hours, if that. Like 5 hours of restful sleep.
Okay. All right, and do you have any elimination problems?
No, I'm pretty regular.
Okay. And what is your sexual orientation?
Straight?
So you're heterosexual?
Yes.
Okay. And are you sexually active?
No.
Okay. So that would mean no safe sex either?
No.
Okay. Do you have access to medical and dental care?
Yes, I do. I'm under my parents' insurance plans.
All right, and have you ever been abused before at home or even at work or school?
Like physical abuse?
Any kind of abuse?
No, not that I think of, no.
Okay. And so there's no current abuse either?
No.
Okay. Do you have any safety concerns in current living or working environment? Do you consider your job or your schooling to be safe?
I think they're pretty safe, yeah.
Okay.
Haven't had any problems so far.
Well, I guess that's not a bad thing. All right. And do you have any financial concerns?
No, I'm fully dependent on my parents.
Okay. Do you have any legal issues?
No.
Okay. What do you need to feel more safe and secure in life?
More safe and secure in life. Can you give like an example?
Well, for some people, it would be a safer job. It could be more money. It could be even a home for the less fortunate.
I guess have a better job that's a little more stable.
Okay. So a more stable job. All right. Can you describe your family? Your family's origin?
Like where they're from? Well, me and my parents we were all born in America. So my grandparents on my mother's side, but on my dad's side, one is from Argentina, and the other one's from Guatemala.
Okay. And is there anything distinct about their culture?
They kind of just assimilated to American culture.
Okay. All right. So, how much of a sense of love and belonging did you experience in your family?
I felt like I had a lot of acceptance and love from my family. I never felt outcasted or anything like that.
Okay. And who made you feel special?
My parents. Such an odd question to ask.
Well, it's all part of the evaluation. So, don't feel like you can also don't feel pressured to answer anything you don't feel comfortable with. Okay, and who was affectionate to you during childhood?
I would say both my parents were really, really affectionate toward me. I wouldn't say one of them was more so than the other.
Okay, and how is love communicated in your family?
We're very physical. We'll give each other a kiss on the cheek, or we'll hug, or we'll even say words of affirmation.
Okay. All right, and can you describe how discipline was handled in your family?
Well, if I ever got in trouble, I would be spanked.
So physical.
Physical. Thankfully, I didn't get in trouble too much as a child.
Sounds like you were a well-behaved young lady. Okay. And where do you go, and who do you spend time with now, in order to feel a sense of belonging?
I would say I would spend time with my parents, or maybe even my one of my close friends.
Okay. Okay, can you describe the quality of your peer group relationships during your lifetime? So, let's start with childhood. How are your peers in childhood?
I guess I had a good relationship with my friends during when I was younger. I don't really remember too much from my childhood.
Okay, and what about adolescence?
As an adolescent, I really only had one really close friend, but me and her are very close. So I say we have a pretty great relationship.
Okay. So would you say it's better than childhood?
I think it's better than childhood.
Okay. And tell me about your young adulthood.
Well, I kind of branched that a little more. I made a little more, had more friendships.
Okay.
I used to be a lot shyer than I am now.
And did you say different kinds of people, maybe?
Yeah, a little more diverse than definitely different than me.
Okay. Okay, so let's go back to your adolescence. Would you say that people, your peers, were the same as you, as opposed to now?
Well, she's yeah, we're me and her very similar
Okay.
in our personalities.
All right, and seeing as that you are still a young adult, we're going to go ahead and move past the middle and late adulthood section now. Okay, so significant dating, romantic, and sexual relationships. How are those?
I don't typically date. I
Okay,
focus more on school and work.
sure. All right, and marital history?
I'm not married.
Okay.
I've never been married.
And how are your family dynamics and quality of relationships with children? Do you have any children?
I don't have any children.
Okay. What about the members of extended family? How are you with your other parts of your family?
I'd say I'm pretty close with some of my extended family.
Okay.
Like, you know, like my grandparents, my cousins. But me and like my aunt and my uncle, we're not really all that close. We tend to get into fights whenever we're together in the same room.
Okay. Okay. And can you describe your current social support system?
So it would really just be my family and my friends.
Okay. Okay. And would you say you have a sense of belonging in your cultural, social, and work environments?
I would say so.
Okay. Have you ever experienced bullying or discrimination?
Maybe when I was younger, but not anymore.
And by younger, do you mean when you were a child?
Yes, like maybe elementary school.
Okay, can you describe that a little bit?
Oh, you know how kids are. They just say a few mean words to you, and then nothing like physical or anything like that.
Okay.
But it all stopped when I got to middle school.
All right. All right, and what is your religious and spiritual background?
Well, my mom's side, they're all Christian. My father's side, they're Catholic, and I wouldn't say that I'm very religious.
All right. So religious family background. but yourself, not so much.
Yeah, I'm not really religious. I'm a little more science-based.
Okay. So the next part is, do you feel satisfied with your current spiritual status and purposes?
I would say I am.
Okay. And can you describe your strengths?
I would say I'm hardworking.
Anything else?
I'm a really good listener. I love to volunteer. I would say I'm open-minded.
Okay.
And I think I'm really self-confident.
All right. That's an interesting combination. Being anxious and confident, but everyone's a little different. So what are your weaknesses then?
That even though I am confident, there are times where, like, you know, a lot of things are happening at once. I'm not really good at multitasking,
Okay.
and that can cause some stress.
Would you say you don't handle stress well? Okay. And on a 0 to 10 scale, what would you rate your self-esteem?
I'd say about 5.
You okay?
It's pretty. I think it's pretty average.
Yeah, right down the middle.
It's average, yeah.
All right. And what would you do to help improve your self-esteem?
I guess, like, doing self-affirmation.
Anything else?
Can I give you some examples?
Well, for some people, their self-esteem is linked to how they look, especially with young ladies. So some people might say, I would work out more, or I would do a diet, or I would lose X amount of weight, or I would get a makeover. Some people would say things like that.
You know, I actually do feel a lot more confidence. Like, you know, after I work out, I actually really like working out. I think it makes me feel a lot better.
Okay, so working out more often. And can you describe past events or experiences that have contributed to your positive sense of self-worth?
I would say, like, yeah, I would say working out that too.
And what do you consider to be your biggest accomplishment in life?
Getting into nursing school.
Okay. Okay, can you describe past experiences that have contributed to low self-esteem?
Like I said, when I was, like, younger in elementary school, I used to get bullied a little bit.
All right, and what are some of the biggest disappointments or failures that you have experienced?
disappointments. Normally just school, like if I like make a grade that I didn't want.
Okay. And how do you cope with their experiences of failure?
Well, I'll go work out, or I started doing journaling, which has really helped.
Okay.
Or even just talking to a friend.
All right. And if you could change one thing about yourself, what would it be?
I guess it would be my body shape. I think I like to be a little more fit.
Okay. And what do you like most about yourself?
I like my personality.
Very good. Alright, we have 4 pages to go. We're doing very well. You're doing great. Okay. And what do you think is your purpose of life?
My purpose in life?
Yes.
I think my purpose is to become a nurse and to help those in need.
Okay. What gives your life meaning?
I guess your life meaning would be being with my family, spending time with them.
Okay, being with loved ones. What are your goals for the future?
To pass my NCLEX and become a nurse.
Alright, what needs to happen in order for you to feel happier and more satisfied with life?
I think I'd be more satisfied if I had more time to besides like studying, to really spend more time with those who I love.
Okay. And what would you like to accomplish while you were in treatment?
I guess to learn how to cope better with stress. So it doesn't go into a full-blown panic attack.
Okay, and based on the... Okay, hold on, give me one moment.
Okay.
Alright, so now we're gonna get to the mental status portion of this. And could you tell me about what your predominant feeling is?
Right now?
Yes. Or just in general, how do you feel?
So I feel pretty content.
Okay. And, okay. Could you tell me about, where we are right now?
We are at Texas Women's University on the 4th floor.
Okay, that's right. And, what is your name one more time?
Caitlin Flores,
All right, date of birth,
June 1st, 1996.
and what time is it?
Time,
Yes.
a little after 2,
What day is it?
September 12th.
That's right. Okay, so you're Norian times 4. Okay, so very good. And I'm gonna go ahead and assess your memory. All right, so I'm gonna give you a word, a 5-letter word. And I'm going to ask you to spell it forwards and then backwards.
Okay.
Blues. Can you spell that?
B-L-U-E-S.
And
S-E-U-L-B.
sounds right. Okay. And 7s and 3s. Are you familiar with this?
No, I know the numbers.
Okay. All right. Do you remember that word?
Blues?
That's the word. Okay. So with okay, 7s and 3s. Can you? Okay, I guess I'll put 7s and 3s, and tell me how many there were. 7, 3, 7, 3, 7, 3, 7. How many 7s were there?
4?
How many 3s were there?
3?
Okay, I think you're intellectually checking out. You seem to remember the word and the amount of numbers I said just now. And, I'm gonna assess, name the last 5 presidents.
Oh.
Yes, starting with the present.
So, Donald Trump, Obama, the Bushes. I don't really remember the last 5.
Well, you got 3. So
George W. Bush, George H. Bush. There were 2 of them, right?
there were 2. Okay. Where's the Statue of Liberty located?
New York. There's also one in Paris, right? The original?
Well,
I think there were 3.
I'm only familiar with one Statue of Liberty.
There's 3 statues.
Okay. Well, so there are. And what do we celebrate on the 4th of July?
Independence Day?
Okay. And what happened on September 11th of 2001?
That was when 2 planes flew into the World Trade Center.
Okay.
It was also my grandmother's birthday.
Okay. And what is the capital of Texas?
Austin?
Okay. Believe that's correct.
But then what would you have said if I said El Paso?
I just would have wrote it down and continued. Okay, I'm going to ask you to read and write sentence.
Okay.
Could you read this sentence and write it?
Listen to patient's speech and estimate patient's grade level based on vocabulary.
Yes. So you can read and can you write?
The whole sentence?
I believe that's what I asked, yes. Okay, and you can write. Very good. Okay, can you tell me the similarities between an apple and an orange?
Well, they're both fruit. They're both round. They're both the same size. They're both sweet.
Okay.
They both have seeds.
All right. And the next statement is the grass is greener on the other side of the fence. What does that mean to you?
That there's always something better on the other side.
Two heads are better than one.
So it's better when you have more than one person to give their ideas and their points of views.
And all right. Okay, we're almost done here. And do you understand your condition?
Yes, I understand that I have an anxiety disorder.
Sure.
And that can be caused by the chemical imbalance that I have, and the medication I take should make that better.
All right. That concludes the exam. Thank you for your time.